Hello everyone. Today we are going to see about dilated cardiomyopathy. So before that we have to know the classification of cardiomyopathies: dilated cardiomyopathy, hypertrophic cardiomyopathy, restrictive cardiomyopathy. Three cardiomyopathies are there. So in this video we are going to see detail about dilated cardiomyopathy. Okay. So let's get into the definition of dilated cardiomyopathy. So what is dilated cardiomyopathy? Is characterized morphologically and functionally by a progressive cardiac dilation and contractile dysfunction. Okay, both morphologically and functionally there is only two progressive conditions. One is cardiac dilation, that is enlargement of heart. Okay, and second is contractile dysfunction, because we have already have seen in the previous video that dilated cardiomyopathy is associated with systolic dysfunction. So because of that there is contractile dysfunction. So only 2 points are there: cardiac dilation and contractile dysfunction, both morphologically and functionally. Okay. So, the arrhythmogenic right ventricular cardiomyopathy is also included in dilated cardiomyopathy. Okay, just keep that in mind. And next, we are going to see in detail about pathogenesis, clinical features, treatment, and morphology of dilated cardiomyopathy. So, under these headings, this today's class will be goes on. So, first is about pathogenesis. Under pathogenesis, there are many conditions. Okay, but the very few which are important are genetic influences, second is myocarditis, third is alcohol and toxins, and the fourth one is childbirth, and the fifth one is iron overload. So we're going to see in detail about these topics. Okay, first is genetic influences. So first of all, about 30 to 50% of cases are because of genetic. Okay, all the out of all the dilated cardiomyopathies, 30 to 50% of cases are genetic. Okay, so this is because of mutation of more than 20 genes encoding proteins. Okay, and the mutation in TTN gene is about 20% of all cases, and autosomal dominant inheritance is the most predominant cause. Okay, and there is also excellent autosomal recessive, and mitochondrial inheritance is also there. Okay, and the second is mitochondrial defects are found in pediatric population, while X-linked defects are found in population after puberty. Okay, only few points are there. About 30 to 50% of cases are under genetic, and this is because of mutation of more than 20 genes encoding proteins, and the mutation in TTN genes is only amounts of 20%, amounts 20% of all the dilated cardiomyopathy, and the autosomal dominance inheritance is the most predominant, but there is also autosomal recessive mitochondrial inheritance also there, and the mitochondrial defects is found in pediatric population, while X-linked is found in after puberty. Okay, so next is myocarditis. Sequential endomyocardial biopsies have documented progression from myocarditis to dilated cardiomyopathy. Okay, so next is alcohol and other toxins. Alcohol abuse is strongly associated with development of dilated cardiomyopathy. That is, alcohol have direct contact with dilated cardiomyopathy. Okay, so alcohol is a major cause of dilated cardiomyopathy. And the next is ethanol toxicity underlies myocardial injuries. Okay, ethanol toxicity causes increment in the myocardial injuries, and chronic alcoholism causes thiamine deficiency, which will lead to everybody we know that very heart disease. Okay, so alcohol is very dangerous to dilated cardiomyopathy. Okay, it is a major cause. And next we'll go with other toxins. Only three toxins are there, you should keep it in mind. First one is doxorubicin. Okay, second one is tyrosine kinase inhibitor, which is a cancer therapeutic, and the third one is cobalt. Okay, it is used in beer production. Okay, only three: doxorubicin and uh, tyramine tyrosine inhibitors, sorry, and the second one is cobalt. Okay, next is iron overload. Iron overload in the heart can result from either hereditary hemochromatosis or from multiple transfusions. Okay, when your blood is transfusing like again and again, you can get iron overload. And in hereditary chromatosis, which is a condition where the body absorbs more iron from the heart, so because of these conditions iron overload can be a cause, and because of iron overload we can get dilated cardiomyopathy. Next is clinical features. Occurs at any stage, okay, any age, but about 20 to 50 years is very common. Okay, even in childhood it may occur. It presents with slowly progressive signs and symptoms of chronic failure. First at the starting stage there will be no signs and symptoms, but after that there will be signs and symptoms of chronic heart failure, which are dyspnea, easy fatigue, poor exertional capacity. Okay, next is ejection fraction is less than 25%. What is ejection fraction? It is the volume of blood ejected from the ventricle, so that will be less than 25%. Okay, and death may also occur. Okay, next is treatment. Only three treatments are there: cardiac transplantation and the long term ventricular assist, and next is short term ventricular cardiac support. Only three things, just keep it in mind. First one is cardiac transplantation, second one is ventricular assist, which is given long term, second is mechanical cardiac support, which is given very short term. Next is morphology. There is a little about morphology. Okay, heart is usually enlarged, heavy, and flabby. It becomes weight like 2 to 3 times normal weight. Okay, second point is regurgitation is present. Okay, because of some valve problem, mitral valve or some problem, regurgitation is present in the heart. The third point is histologic abnormalities in dilated cardiomyopathy are non-specific. Okay, they have no specific conditions, okay, to identify. Third one is fourth one, sorry, most muscle cells are hypertrophied. Okay, all, not only heart muscle, most of the muscle cells are hypertrophied with enlarged nuclei, and interstitial and endocardial fibrosis, subendocardial scars may replace individual cells of or group of cells. Okay, that is interstitial and endocardial fibrosis or subendocardial scars may be present, and not only heart muscle, other than heart muscle, like our skeletal muscle also becomes enlarged. Okay. Okay, as I said before, there is a contact between arrhythmogenic right ventricular cardiomyopathy and dilated cardiomyopathy. So, what is arrhythmogenic right ventricular cardiomyopathy? It is an inherited disease of myocardium. Okay, it is an inherited disease of myocardium. This is associated with right ventricular failure and right ventricular rhythm disturbances. That is left side of the heart. Okay, right ventricular failure and right ventricular rhythm disturbances. There may be sudden death, and it is an autosomal dominant inheritance. Okay, it is an autosomal dominant inheritance, and it is associated with Knox-Horse syndrome. So what is Knox-Horse syndrome? Some clinical features of Knox-Horse syndrome are woolly hair, and there will be cell adhesions, etc. So this is also associated with Knox-Horse syndrome. So let's go into the questions. 4 marks the cardiomyopathy, dilated cardiomyopathy, and 1 mark 3 types of cardiomyopathy. So what is cardiomyopathy? We have been learnt in the previous video. Cardiomyopathy are a heterogeneous group of disease of the myocardium associated with mechanical or electrical dysfunction, exhibit inappropriate ventricular hypertrophy or ventricular dilatation, and it is due to a variety of causes that frequently are genetic. 4 points: heterogeneous group of disease of myocardium associated with mechanical or electrical dysfunction. Fourth point is ventricular hypertrophy or dilatation, and the fourth point is there is the frequent causes genetic, we have know that. So what is dilated cardiomyopathy? First you should write the definition. The progressive cardiac dilation and contractile dysfunction, both morphologically and functional. You have to write in detail about the definition is very very important. And second, you have to write the connection or letter that is including, okay, arrhythmogenic right ventricular cardiomyopathy is included in dilated cardiomyopathy. You should write that. And these topics, pathogenesis, clinical features, treatment, and morphology, you should write in detail. So under pathogenesis, these points: genetic influences, myocarditis, alcohol and toxins, childbirth, iron overload, you should write. So you should write each and every topic in detail. These toxins, doxorubicin, tyrosine kinase inhibitor, and cobalt, you should write. Next you should write the clinical features, ejection fraction, treatment, 3 treatments: cardiac transplantation, ventricular assist, and mechanical cardiac support. Next is morphology. There is very little in morphology, and also arrhythmogenic right ventricular cardiomyopathy about these things. Okay, right ventricular failure. And one mark is 3 types of cardiomyopathy. We know that is dilated cardiomyopathy, and hypertrophic cardiomyopathy, and restrictive cardiomyopathy. Only 3 cardiomyopathies are there. So thank you.